talk on beta glucuronidase. You've just ordered a GI test. Beta glucuronidase is high. And you kind of know what that means, but I don't know. It's like a little kind of a challenge to really understand what to do about it, ultimately. You could use calcium D-glucarate, but is that the whole answer? I don't know. Let's investigate just a little bit. So there is a microbiome estrogen connection. And one of the things that we're concerned about with this connection, if there's excess estrogen or estrogen dominance in the system, is the risk of breast cancer increasing. The reason why this can happen is because estrogen is a growth hormone. So if you get excess estrogen coming from the intestinal tract back into the bloodstream, you're going to have potential problems. And the way this works with beta glucuronidase specifically is if you have an elevation in beta glucuronidase due to a problem with dysbiosis or a problem with a good gut bacteria not being present, the bad ones being there in an excessive kind of way, then your body will reabsorb or pull the estrogen back into the bloodstream that you were trying to dump out in the gut. And that puts you at risk of estrogen dominance. And we have too much estrogen, that can increase your risk of a variety of different kinds of cancer, including breast and prostate and colon cancer. So these toxins are being reabsorbed. Your body's trying to excrete the estrogen, and instead of getting out of the body, it's getting reabsorbed. In the old days, you used to call that autotoxicity. But anyways, the net result of this is that you're not only reabsorbing all kinds of toxins, but one of the things specifically you're reabsorbing is estrogen. Now, of course, it's unusual to think that you would just be reabsorbing estrogen. If you're having this kind of dysbiosis that's leading to high beta glucuronidase, you're going to have some other problems as well. So in terms of treatment, you want to eliminate the dysbiosis, get the right kind of vegetables and whatnot, the cruciferous vegetables, so you're lowering your risk of this problem happening in the first place, and then support the glucuronidation pathway in the liver. And you can do that with supplements. I'd like to use broad spectrum combination products that include things like methionine, glutathione, cysteine or N-acetylcysteine, glutamine, etc. You can also use the different herbs and plants like silymarin and resveratrol and curcumin to really get the liver working more effectively, and prebiotics and probiotics, etc. And eventually, if you can lower the toxic burden on the liver and the liver is clearing things more effectively, and you improve the gut by eliminating the dysbiosis, you're going to resolve this problem. In the short term, if you want a quick fix, this is not the deeper fix, you can use calcium D-glucarate. I'm not against that, but you really want to prioritize the dysbiosis treatment and the treatment of the whole liver, not just part of the liver with just a narrow look at this. You want to see a more global perspective on the overall toxicity of the patient in general. Because again, if they have a problem with beta glucuronidase and they're recirculating their estrogens, they're probably also recirculating other toxins. Their liver is probably overwhelmed in general. The gut is dumping all kinds of waste products out, not just estrogen. And so you've got a bigger problem on your hands than just the, something that calcium D-glucarate could fix by itself. If you haven't heard yet, Rupa Health is a great place to order labs. You can get $100 off your first lab order using this coupon. So scan that QR code and I'll talk to you soon. Thanks.